So, what can we expect as we're aging? So, I want to talk about our muscles and our bones. So, as we age, we know that it's very normal to have a decrease in lean body mass. So, that nice lean muscle mass tends to decrease as we age. Muscle tissue is actually replaced with fatty deposits. So, you may feel as you like touch your arms or your legs, you have felt that muscle mass decrease. That is a completely normal part of aging. And with our bones, we see a decrease in bone density. I know that this is a very much a hot topic and something that people talk about often is your calcium levels, osteoporosis, osteopenia, and that loss of bone density. Your peak bone density is actually at about age 27 to 30, depending on your kind of genetics and your general health status, and you slowly decrease bone mass after that. The good news is we can do things to maintain that bone mass, though. Most commonly, we see that bone decrease in our vertebrae, so along our spine and in the arch of your foot. So you might have had a nice arch that starts to flatten out a little bit. Additionally, in our bones and in our joints, we see that decrease of joint cartilage. So you may have been diagnosed with something called osteoarthritis, or you may have heard the term bone on bone. That's that nice, smooth, gliding surface decreases and it gets worn out, and that's a normal wear and tear on the joint. So this is what we can expect, but the good news is we could kind of see how it looks. So you think about your loss of height, how sometimes you may feel some inflammation, some pain, some stiffness in your joint, particularly in your fingers, in your hips, and your knees. A lot of time is where this inflammation and stiffness is felt. You may feel a decrease in endurance, so a decrease in your ability to walk a certain distance, getting a certain amount of things done throughout the day. COVID certainly hasn't helped any of that because we've all kind of been in our homes a little bit more and not out and about as we used to. We tend to see that rounded posture as we age. So that has to do with the decrease in bone density in that vertebral or the very small spinal bones can contribute to that rounded posture. Plus, gravity also has a little bit of an effect of that. It tends to push us forward. You may feel your walking speed is decreasing. And like we talked about with the changes that we expect in your muscles, you may feel that decrease in strength. The great news is exercise can really help with a lot of this. And that's why it's even more important as you age to build that really healthy exercise routine so you can keep yourself and your body as active and as healthy as possible. So what we're going to go through today is the foundations of building that exercise routine and some examples that you can maybe try to integrate into your own routine. So the benefits of exercise. We know exercise is wonderful. I don't have to come on here to this presentation to tell you that, but why is it so wonderful and what does it do for us? So exercise is proven to improve our strength and endurance. It's proven to decrease the risk of falls, especially those in the age of over 65. We do know that being on a regular exercise program, having good strength in our legs and particularly in our ankles to make sure you're able to lift your feet off the floor directly contributes to a decrease in falls. It helps improve your balance. I think that one is kind of self-explanatory in terms of why balance is so important. Exercise can help boost your mood. I know through the past year and a half with all the changes and the stressors going on, that exercise was really an outlet for me to help kind of decrease some stress and anxiety. And exercise can also help decrease pain. As you exercise, your body releases something called endorphins. Endorphins can help boost mood and really help you feel good and decrease some of your pain. So building an exercise routine, how much is exercise? How much do you need to really make that difference? So the United States Department of Health and Human Services recommends 150 minutes of moderate intensity aerobic activity or 74 minutes of vigorous aerobic activity a week. That translates to, so most of us are going to fall into that moderate category, which we will talk about in a few slides. But 150 minutes is about 30 minutes 5 days a week. And if you break that down, that really is a manageable number to fit into your daily life. And really, what motivates me is thinking about my why. So, what makes you want to improve your health? Because if we're just exercising or if we're doing anything just because we're supposed to, we know that's not going to be an effective way to build a routine. But what's motivating you? Do you want to be able to walk further? Do you want to be able to stand longer to do certain activities you enjoy or spend time with your family or your grandchildren? Really think about what is your motivator, and that's what's going to help you build this really nice routine for yourself. So we have two principles of exercise. We have aerobic exercise. So that's any sort of exercise that increases your baseline heart rate for an extended period of time. So you think of things like biking or cycling, brisk walking, rowing, elliptical trainers, jogging, or jumping rope. In case you weren't familiar with what an elliptical trainer is, I put a picture of one right here on the slide. It's basically a glider where you stand and glide back and forth. It's a little less impact on your joints than a treadmill is. What is important about this is definitely consult your doctor about heart rate parameters if that's something you are going to be tracking and using as a way to monitor your exercise. Certain medications you're on, especially blood pressure medications, can change your heart rate response to exercise. So it's really important that you talk to your physician prior to beginning a routine. So how we talked about a few slides ago, we talked about that moderate intensity or that vigorous aerobic exercise and what makes one moderate versus vigorous. So this is the RPE scale, or the rate of perceived exertion scale. This is what we use in physical therapy, and it's generally accepted across medicine as a way to measure the amount of effort you're putting into an exercise and how it's challenging your body without measuring heart rate or blood pressure. So as you can see here, it's a scale of 1 to 10. 1 being very light exercise, 10 being maximal effort activity. And what you do it, you determine it based on your breathing and sometimes your ability to speak. So very light activity is kind of like what we're doing just now. You're listening to a presentation, there's no exertion going on. Hopefully you're sitting comfortably. Maybe you even have a snack, like sleeping, watching TV. Your body is at its resting, at its steady state. For 10, like 10 out of 10 exertion or 10 out of 10 on the RPE scales means you are at your max effort. If you're going to do this for 2 more seconds, you are going to have to sit down. You are completely out of breath. You are unable to talk, and you could only maintain this for a very short amount of time. 10 out of 10 efforts are usually in a workout only done by like professional, semi-professional, very high level athletes for no more than a 30-second interval at a time. So for moderate activity, so if you think about maybe going for a walk, going for a bike ride, jumping rope, you want to land somewhere between a 3 or a 6. So that's activity that you are breathing heavy. You can still speak through it though. You can hold a short conversation. You won't be giving a lecture or a talk like I am right now, but you can kind of, someone says, how do you feel? I feel good. How's this pace for you? You can have that conversation with them. It's going to start out as somewhat comfortable, but it's going to become noticeably more challenging. So it's something that maybe if you're going for a brisk walk, in the first 3 minutes of a walk, you feel like you're at a 3. But as you continue and build your speed and you get a little bit more tired and those muscles start to fatigue, you maybe feel like you're more at a 4 or a 6. And that's for that moderate level activity that you're trying to do for 30 minutes 5 times a week, or that 150 minutes total. Now, for vigorous activity, that's that much more challenging level of activity that you're going to do for less time. So this is, you're starting at a 7 on the scale. You are uncomfortable. you're short of breath, but you can speak a sentence. So sometimes maybe you're saying, I'm good, and you're catching your breath for a few seconds before you say your next thing. And this is really quite more challenging. And I think the word uncomfortable is a great way to describe it. You feel those muscles working, you feel that your breathing is heavy, and you feel like you really are working through this. This could be from a 7 to a 10. For this, I don't like for myself to go really above that 8 or 9. I just tend to get like it just doesn't motivate me to do that. So when you are working up to that 9, it's very difficult to maintain that intensity. You can barely breathe and you're really only speaking a few words. So a good example of how to incorporate this vigorous intensity activity is by saying, I'm going to do intervals. So if you're on a stationary bike or if you're cycling, you say, I'm going to go for 30 seconds or for 20 seconds or whatever works for you. I'm going to be at a 7 or an 8. So I'm going to be pedaling really fast. I know I'm going to feel breathless. I'm not going to be able to hold a conversation. My legs are going to be burning, but I know I'm only doing this for a short time. And then you go back down and you recover for maybe a 2 or 3 for 30 seconds before you start again. But really, it's about finding where on the scale works for you and knowing what your target is to make sure you are getting a good session of exercise in. So I like to use brisk walking as an example. So if you are going to walk for exercise, you do want to make sure it's at a little bit quicker of a pace than normal, so your body can feel like it's working. Or maybe you incorporate some hills in there. This way you start out and you're on flat ground, but as you start to walk, maybe after 5 minutes, you start to ascend a hill, and that intensity or that effort gets closer to a 4 or a 5 than it was the 2 or 3 when you started. But this is a really great scale. I would highly recommend using this as your exercise and just as a gauge too. It's a great way to track progress. So maybe you say, okay, my goal is to maintain a 4 for 5 minutes today. And then 2 weeks from now, if you're able to maintain that 4 effort for 20 minutes, that really shows an improvement in your aerobic capacity. And so, how to incorporate that aerobic training? As I spoke about, you want to start slow. They always say every long journey starts with a single step. So if you are someone who hasn't been exercising a lot, maybe you set your goal at walking for 5 minutes, or maybe you start with those intervals of, I'm going to try to do a 1 minute interval walking at a level 5. And then I'm going to let myself recover for 2 minutes at maybe a level 2 or a 3. And then I'm going to go back up again to a 5 minute interval. This interval training is really effective to help build endurance, whether you are someone who's just trying to increase your walking time or working up to running a marathon. This is actually the method that's used for runners and athletes. Is you start slow, you start with that interval, you give yourself some rest, and then you go back to that increased effort. You could challenge this by increasing your duration. So increasing the length of the interval you're putting the effort in, or you could just do it for longer. So instead of doing 10 minutes, you go for 20 minutes. And it's really important to choose an activity that you enjoy. So whether it's cycling, whether it's being on the elliptical, whether it's walking, jumping rope, whatever is going to motivate you and you enjoy, that's what I suggest you choose. And it's always good to vary things as well, because our minds tend to get bored, and just it's good to challenge your body. So maybe you go for a walk Monday, and on Tuesday you try jumping rope, and then you go for a walk again on Friday. Just continue to vary the routine. Too much of one thing is never good. And I always try to incorporate aerobic training into my daily activities. So I currently work in our Paramus location, but for a very long time, I was working on the main campus on 70th Street. And I used to kind of walk a mile each way to and from work. And sometimes on the way home, if I knew I wasn't going to have time to get in a workout, I would try to make myself walk at that brisk pace to get some aerobic training in as I was walking home. Sometimes I run If I'm going to the grocery store, I'll say, you know what, I'm going to run to the grocery store to get my workout in. There are plenty of ways that you can incorporate that aerobic training or that increased effort for a longer duration into your daily routine. And the importance of balance. And I think we talked about this. You really want to vary your routine for maximum benefit. If you continue to do the same thing over and over again, your body adapts to it and it no longer becomes a challenge. So, that mile walk at one point that was very difficult, it may become leisurely 2 or 3 months down the line. So, it's important to maybe switch it up to cycling, try an elliptical trainer, even try swimming, something else to challenge that heart rate to help improve your endurance and your functional capacity. And it's also important to vary both aerobic and strength training because we want to build that endurance, like we talked about. We want to be able to walk further, walk longer, stand longer, climb the stairs without getting out of breath. But we also want to make sure we're building some strength because if we go back to our first few slides, thinking about how our muscles change with the aging process, building strength in those muscles is so incredibly important. So, strength training. I know strength training can be intimidating to begin, and sometimes you just don't know where to start. So, strength training, really, the main goals of it are to help build back that lean muscle mass that we unfortunately lose with aging, help prevent further bone loss. We know from research that standing weight bearing activities or resistance training, so meaning anything where you're putting some weight or some force through the bone, helps to maintain our bone density and our bone mass, which, as we spoke about, is really important to the aging process. And it also helps to improve our overall strength and endurance. So, where to start? Your body weight is perfect. Our bodies serve as a weight. It's very easy, and we'll go through some exercises that you could get started with just your body weight that help to activate muscle, get some really good weight bearing through your joints, and then you work your way up from there. So, starting with light hand weights, or one of my personal favorites is actually resistance bands, provide a really great opportunity to get some strengthening. They're super small, they're usually easy to fit in a bag or a backpack. So, if maybe you're going to go to the park for a walk and then you take your resistance bands with you and then you do a few exercises once you get to the park and then you walk home. And then you focus on we're going to focus on the big muscle groups. So think about your quads in your legs and through the back of your legs, the big muscles in your arms and your shoulders to really help build that strength. And so we're going to next go into our exercise examples. As I spoke about earlier, that these are stretches and exercises. The examples I'm providing are for healthy people without pre-existing conditions. Please, please, please speak to your doctor, speak to your physical therapist about a routine that can be done, that can be tailored to your needs. These should not cause pain when you're exercising. You may feel your muscles working and burning, but ultimately they should not cause any sort of pain. So the first exercise is a sit to stand, something we all do a million times a day without thinking about it. So this is a really great one to incorporate into your routine. So you want to think about sitting on a chair that's stable, not like this desk chair that I'm swiveling in, but a dining chair or a kitchen chair works really well, where you think about sitting up nice and tall. You pull that belly button up and in to activate the abdominals, and you push through your heels to stand up all the way. Now, when you go to sit back down, you don't want to just plop into your chair. You want to think about nice and slowly lowering yourself down so you feel the muscles in your legs moving. Or I'm sorry, so you feel the muscles in your legs working. The lower the surface, the more difficult this is going to be. So maybe you want to start yourself on a higher surface, or a chair is in the picture that has arms to help you push off. And then as you gain that strength and as that becomes easy and you're thinking back to your RPE scale, you're like, oh, this is only a 1 for me to get up and down. You lower that surface, or you don't use your arms, you put them across your chest to make that a little bit more challenging for you. The next exercise is called a long arc quad. So this is one that you can start with just body weight. So where you're just sitting Up nice and tall. Again, you pull that belly button up and in to activate the abdominals to get some really good abdominal activation and core strengthening happening. And one leg at a time, you kick your leg all the way out straight, pointing the toes towards the nose, and you bring your leg back down. When I do this exercise, I personally like to put my hands on the top of my thighs because then you directly feel that big muscle at the top of your thigh, your quad muscle working and popping right into your hand. Again, just like with the sit to stand, we want control on both ways. So you're kicking your leg out in a controlled manner. And as you bend your knee back down, you're also going nice and slow. Standing hip abduction. So abduction is just our fancy way of saying out to the side or away from the body. So this one I would highly encourage to do while you're holding on to something. A kitchen counter, a bathroom sink, the back of your couch works really, really well. You're going to stand up nice and tall, and you're going to think about your standing knee is going to put a little bit of a bend in it, just as that picture's showing. And the other leg, you're going to point your toes towards your nose, and you're going to lift your leg out to the side and bring it back down. To do this exercise properly, you're probably only lifting your leg maybe 6 inches out to the side. If you go out too far, you tend to do a teacup type motion where your leg goes one way and then your body goes the other. So really think about keeping that trunk up nice and tall. Similar to standing hip abduction, we have hip extension, or bringing your leg back to the side. So you're going to stand facing your support surface with your hands resting on it. You're going to squeeze your bottom to bring your leg back behind you to keep your knee straight. This one you should almost feel where your bottom meets your leg. That crease right there is where you'll really feel this exercise work. Hip extension is really important for upright posture and standing up nice and tall. Standing calf raise. This is one we all often do without even thinking about it. And this can also be modified to the sitting position. So you're standing or sitting, you start with your feet flat to the ground, and you think about pushing through your toes to bring yourself directly vertical. You want to avoid pitching yourself forward. You want to think about a nice rise straight up. You're going to feel the burn in the calf muscles or the muscles in the back of your thigh. And same thing with every other exercise we've spoken about. You want to come back down in a controlled manner. Standing marching, this one is fabulous for balance. So standing, again, holding on to a surface is needed. You think about marching your knees up and down. Now, as I'm doing this, I know you can't see my lower body, but I promise I'm doing this. My shoulders aren't really moving and my trunk is staying nice and stable. That's going to be your goal when you do this. As you start, you may notice your balance isn't as good and you're kind of swaying side to side. As you improve, your goal is going to be to keep your trunk really stable. So if you were on a Zoom call just like this, no one would know you were getting your marching in as you're talking to them. Next thing we're going to talk about is the supine bridge. So if supine or laying down is a comfortable position for you, this is an excellent exercise. So you start by laying on your back with your knees bent, and you don't just fling your hips up. I see that mistake a lot. You want to think about squeezing your bottom and slowly lifting your body up and then coming down nice and slow. For this exercise, if you're feeling a lot of pressure through your shoulders or your upper back, it may mean you're going too high. You actually don't have to lift that high on this exercise to get a really effective routine in. And then you want to lower it nice and slow. Then we have the dead bug. This one's a little bit more complicated, but when you lay on your back, you pull the belly button up and in to flatten your lower back off the floor, and you alternate moving your arms and legs out to the side. You will really feel your abdominals kick in with this one. Also a good test of coordination to kind of get a nice rhythm going. Bicep curl. I'm sure we have all heard of this exercise. Really great to do. You could start with just body weight. You could use light weights. You can use cans of soup. water bottles, really starting with 1 or 2 pounds, or you could use resistance bands. If you have the long bands, you could step on the band and curl your arm up and down, or you can hold the band with the other hand to just bring your arm up and down, really feeling that muscle right in the front of your elbow work. And then you have scapular retraction, or this is really an important exercise for your posture. If you take one exercise away, I think this is a really nice one that everybody can integrate into their routine. But you stand or sit up nice and tall. You bend your elbows to 90 degrees. I like to do this holding a resistance band, but it's certainly effective with just your body weight. And you're going to start by rotating your arms out to the side and squeezing your shoulder blades down and back behind you. So those muscles right in your upper back, you want to think about pinching them together and then relaxing. This one, you could start to add a hold to it if it gets easy. So instead of just pinching back and coming forward, you could really think about pinching back, holding for 1, 2, 3, and then relaxing. And then tricep extension. So we got the biceps, which are in the front of the arm. You definitely want to get your triceps, which is in the back of your arm. You could do this standing, bending over, bring your elbow back straight, and then bending your arm. If bending forward is uncomfortable for your back, you can certainly do this one upright as well. And a shoulder press. Again, this is one depending on your individual pathology and your anatomy, this may be a little bit more challenging, but holding weights, cans of soup, water bottles, or nothing at all, thinking about lifting your arms all the way up and then bringing them down nice and slow. You want to avoid shrugging your shoulders into your ears with this one. You want to think about relaxing the shoulders and lifting the arms up and down. And like I said, resistance bands, light weights, no weights at all, whatever works best for you. So, in conclusion, you really want to think about finding an exercise routine that works for you. I gave you a bunch of ideas here. You really want to think about varying your routine, getting in both that aerobic training and that strength training to help improve your health and longevity. In order to motivate you, you really want to think about your why and what makes you want to exercise and what makes you want to improve your health. And just make sure you're incorporating both that strengthening and both that aerobic activity. Thank you so much for listening and for your time and attention.